everyone, let us continue to know more about breast cancer during the Breast Cancer Awareness Month. Today we have a special guest with us. Dr. Shabnam Bashir got trained in breast and colorectal cancer surgeries from Tata Memorial Hospital, Mumbai, and advanced robotic surgeries from Roosevelt Park Cancer Institute, US. She is first Vatikuti Robotic Colorectal Fellow of India. She has been running a cancer awareness drive and has touched around 12,000 lives through her talks. She has contributed articles on importance of screening in cancer, latest advancement in cancer therapy, and role of diet in reducing colorectal cancers. She has contributed chapters in many books, including a chapter on breast cancer management in the oncology textbook called A Textbook of Clinical Oncology in Indian Context. In addition, she has contributed chapters in various books, has published around 11 to 12 articles and papers in various index journals, and has many awards from various organizations and conferences to her credit. She has been a proponent of preventive oncology and precision oncology. She has the credit of being the first female organ-specific oncosurgeon of Kashmir to be trained in advanced robotic surgery. She is among a few female colorectal surgeons in India to be trained in CRS, HIPAC, and PPAC surgeries. Welcome, ma'am, and I'm really happy that you could spare some time for us.
Thank you very much for that kind and generous introduction, Shilpi.
Thank you.
Equally thrilled, please.
First question to you would be a very generic question. How did you decide to be a doctor, and that too, ma'am, how does it feel to be the first female oncologist or organ-specific surgeon of Kashmir?
So Shilpi, it's that being a doctor is basically a calling. You just follow that,
Mm-hmm.
So there have been a lot of events, and it finally ended up in me getting into the medical field and then deciding to be a surgeon. And once I was in surgery, then you always, as a surgeon, you always want to get rid of that stuff quickly. You want the patient to be relieved as soon as possible. You want to just take that diseased segment out or organ out or the tissue out and give instantaneous relief to your patient and increase the mortality if you can. Increase the longevity of the patients if we can, reduce the mortality and the morbidity. And so that's been a part of it. And then going into the cancers is because, when we talk about the surgical specializations, subspecializations, or super specialities, there are certain branches which, have a lot of that adrenaline rush within you when you're dealing with them, say trauma, emergencies, cardiac events, and cancers, because patients are coming to you in the most distressed forms.
Mm-hmm.
And unfortunately, cancer is associated with, because of the ignorance, with it's associated with death. When you utter the word C, the patient takes it as a death sentence.
Mm-hmm.
Then it gives you a lot of relief, and you're able to help those patients out, help them understand that this disease is not just the end of life, it's just a bend. And you need to, if you present in stage 1, there are survivals as good, 90% 5-year survivals in certain cancers, which is as good as almost the rest of the population. So there's a lot of need to counsel these patients, to be empathetic to these patients, and it gives a lot of that sense of satisfaction when you're able to help this segment of the patients, taking that disease out and letting them understand that this is not the end, the life goes on, and so would you. Mm-hmm. So that's what has been the driving force. And for robotics, I'm basically the first organ-specific oncosurgeon. We have one more girl who's from my place who's already doing oncosurgery, but I've been the first one to go for advanced robotics. I have been the first one to get trained by the grace of God in HIPAC and PIPAC, which are the advanced treatments for any cancer management and cytoreductive surgeries. And it does give you obviously a lot of contentment, because Being in medical field is not just a day's game. You start off quite early after your 11th 12th, and then have a rigorous that kind of a training for 5 years or 6 years, internships, then preparing for your PGs, clearing them, then super specialty training. So it's you're spending your whole life in this profession. And then at the end of the day, you want to do something which contributes a bit more. So you keep on trying, to go for another specialization. It's a never ending process, but it is really fulfilling when you, at the end of that, kind of journey, you look back and you feel that you did something which did create some difference. You were able to add some value wherever you were. And it's a big satisfaction. But at the same time, coming from smaller places or conservative societies, or from the country that we are, overall it's a very difficult game for any woman, because surgery still stays a man dominated field. And when you're out to break those glass ceilings, and then you're trying to do them repeatedly, one after the other, then it's a huge amount of the responsibility as well, because every step that you're treading, basically there is a lot of people who are looking up to you, who are trying to make you your their inspiration. So any wrong step on your part can mar a lot of careers that are looking towards you.
Yes.
So each and every step has to be very well balanced, very well thought of, and it has to actually prove at the end of it that people who were following or who were trying to do the same thing, they were not proven wrong. And you have to give them that kind of encouragement through whatever you're working. Your work has to speak louder than your words.
Very well said, ma'am. I totally agree. A field that you ventured in is male dominated. And yes, that's very true. If you look around, yes, it's very true. So, ma'am, my second question would be, what is actually a breast cancer?
So cancers are basically multifactorial. So many factors, that is interplay of your own genetics and the environmental factors that determines whether we get cancer or we don't get, and which kind of cancer we would get. Breast cancer is a cancer that starts in the cells, within the cells of the breast, in that organ. We have multiple types of the cell. We have ducts, we have lobules, we have the mesenchyma in that. So any cell that starts off with that mutation, which the body is not able to handle, it will culminate into a cancer. So it can start in ducts, in lobules, in mesenchyma, soft tissue, but the commonest ones are the ones that start in the duct, and that's why we call them intraductal carcinomas. And it can spread from there to any part of the body. The commoner organs involved would be the liver, the lung, the brain, and the bone.
Okay.
And contrary to what the common notion is, 85 to 90% of the breast cancers are basically sporadic. So you might not just have any family history. So you have familial cancers, hereditary cancers, and the sporadic ones. In genetic ones, we know that we have been able to pinpoint that gene. This is the gene that is causing these cancers, like BRCA1, BRCA1, BRCA2. But in rest of the hereditary ones, we might not be able to pinpoint a single gene causing those cancers. But in vast majority of them, close to 90%, is just sporadic. It can happen to anyone. So what we're dealing with currently is close to 7 to 8 lakh breast cancers every year, and then 5 to 6, 7 lakh succumbing to that in our country. But having said that, this is again an underestimation, because we don't have all the registries, the population-based hospital registries working well. So we don't know the exact figures. Whatever we quote, this is a mere underestimation of the actual numbers. And what we say right now is that every 4 seconds we are having one breast cancer being diagnosed. And the Globocon data and WHO data says that by 2030, 1 in every 28 women is going to have breast cancer. So it is as scary as that. So we need to understand the need for creating awareness and early detections, because that's the only way we can treat it and beat it.
Yes, ma'am. Ma'am, do you give any advice to the survivors or the patients that there should be a special diet? If so, what kind of a diet do you mention here?
So we have certain modifiable factors in cancers and non-modifiable. So the non-modifiables are the ones that you don't have any control over. For example, your age, or the family you're born to, the race, the ethnicity. Or if you get any other disorder which increases your risk, hormonal imbalances. But the modifiable factors are your BMI, You have to keep it under check. If your weight is on the lower side, your peripheral fat will not get converted into the estrogen, which works as a fuel in breast cancers, many of them, which are especially the hormone positive ones. So the second thing is that the other modifiable factor is sedentary habits. That is a cause for a lot many cancers. 35 to 55% of the cancers are preventable, and because of these lifestyle modifications. So you have to start working on that. You have to avoid sedentary habits. You have to do a lot of exercises and all. And then what we call is early marriage, early childbirth. Basically, sometimes it works for you, because then you're not elderly prima gravida. You're not crossed 35, 40 years of age when you're having your first child. But that might reduce your risk. Breastfeeding is a very kind of protective factor. So, and when we talk about the adequate breastfeeding, it is by WHO at least 2 years of breastfeeding. So you have to breastfeed your child for 2 years and give you some amount of the protection. And hormonal replacement therapies are the other risk factor. So if you're already postmenopausal, or you have had some early menopause or early ovarian knockouts, and you want to replace those hormones, you have to understand that it might increase your risk of having breast cancers in future. So you have to stay very vigilant and look and assess the other risk factors that the patient is having when you're giving hormone replacement therapies. Oral contraceptive pills were something that was in controversy for long, but it's only the cumulative effect of those taken over the period of 5 or 10 years that increases the chances of having breast cancers. Mm-hmm. And the diet, if specifically you talk about the diet, high fat diet you have to reduce as much as possible. Don't take those junk foods, a lot of junk food. Moderation is the key. You have to take some amount of the cholesterol, because that is required in the body to metabolize many other things, to create or produce hormones, and to work in the metabolism of the fat soluble vitamins. But it has to be in moderation. For any general advice that we give to patients or to people, general population, to reduce their risk is stressing upon taking fresh fruits, fresh vegetables, and including some amount of the cereals, rice, potatoes, tomatoes in their food, because potato peels and tomatoes are seen to have some chemicals that help reduce your chances of having cancers. There is no level 1 evidence, and probably for diets we might not get it, but we do say generally that turmeric has anti-inflammatory and anti-cancer properties. So if taken in moderation, there is no harm. So those are the things that you can incorporate in your food. And the other things that you have to stay away from is, for example, if you're having your water bottles in the car, which are not steel, plastic water bottles that is lying in the car, your car is heated up. Whenever the plastic is subjected to extremes of the temperature, whether it is cold or heat, it will release some chemicals, and they get admixed with whatever beverage or food you have kept in that container. And you're basically eating, ingesting, or drinking a part of that carcinogen when you're consuming that. So any bottles left in the cars, you have to be very careful that if they're heated up in the sun, please do not consume that water. Don't keep any foods or water in plastic containers in your freezers. Do not freeze your plastic containers. Any food in the plastic containers. You can use inert substances like steel. You can use glass. You can use copper. That's still safer, but not the plastic ones. The other thing is microwaves, which is very common in the household, utilization, as well as the offices, to heat up or reheat or cook. These are also having radiations. One part is the nutritional value that obviously goes almost close to zero. You lose, because it does some structural changes in your food. So you're not having a nutritious food when you're cooking or reheating in the microwaves. And the second thing is that they are having sometimes micro leaks as well. Those, you have to stay 3 to 4 feet away from your microwaves whenever you're cooking. And if you're cooking and it is already in, active mode, then you don't let children get into the kitchen, and you don't stay close to that, and you don't cook or reheat. Please do not use any kind of ware that is called safe for microwave. It is safe for microwave. It will not get damaged, but it will damage your body. So even if you have to reheat, there is no other way out. Cook and heat in microwave safe glasses.
Yeah.
Yes. So that's very important. The other thing is, your daily toiletries and cosmetics. There is a lot of stuff out there that you use daily, your moisturizers, your shampoos, your conditioners, especially the body lotions, because they stay till your next bath, till 24 hours. And if they're having preservatives, which are methyl, paraben derivatives, then they are very, very, very dangerous for the body. So you might be recently noticing that there is a lot of, trend for having paraben-free products. And this is the reason, because this preservative is one of the commonest causative factors for cancers, especially the breast cancers. And the other advice we give women is that whenever you go out in the sun, try and not wear black colored inner garments, because it absorbs a lot of light, right? So you don't want that light or heat to be absorbed and stored around your organ. So try and avoid black colors in summers. And please avoid wearing wrong size bras or the bras that are having wires, because repetitive trauma to the organ can also initiate processes which are beyond the control of body to take care, and it might culminate into other disorders. And so these are the general advices that we give.
Okay, and, that's a good to know fact, ma'am. Wasn't aware. I mean, I did read that padded bras can cause an organ or a breast to get, having some kind of a problem with the cancer specific something, but wasn't sure. I thought it was just a myth. But
so we don't have level 1 evidences around anything, but when you have data that suggests and that sounds logical, then it's better to follow that if it's not giving you any harm, right? If you avoid that color in summer, and if you avoid the wired bras, then there's no harm doing that, but you're saving your body from at least some amount of the trauma to the organ.
Yeah, true, very true, ma'am, very true. So, ma'am, when a woman loses her breast because of a surgery or a procedure during breast cancer, so, ma'am, you are aware, and I'm sure that a lot of people agree that not only that she loses this part, but she loses a part of femininity. And she also goes through a lot of psychological trauma because of this reason. So, ma'am, what exactly or how do you convince the person to wear a reconstruction solution that is available, either a prosthesis or a kind of implant? I mean, what is the kind of a, as a doctor, how do you go about it, ma'am?
There are a lot many factors. Basically, when we talk about breast surgery, the first thing that comes to any patient's mind is losing the organ. And as you said, they think it's loss of the femininity, which should not be there. Basically, it's the social taboo that we have created around the organs. And a person is a person as a whole. You can't just ascribe one organ to femininity or masculinity. But yes, it does cause a lot of emotional trauma to these patients. They need a lot of psychological support, empathy, counselings, and all. Then once they've decided for any kind of reconstruction or prosthesis, we have to discuss the pros and cons, and we have to see the aggression of the disease. Sometimes we delay the reconstructions if they are tissue reconstructions from the body itself. If the patient has to undergo any radiation and all, we sometimes delay the reconstructions. Or if the cancers have been very aggressive, we wait for first 2 years, because that is the time when a lot of them come back. But once we have decided that we can give or we can offer reconstruction to this patient, whether it is immediate or delayed, then a lot many other things. For example, if we talk about the prostheses or implants, then we have to see the lifestyle of the patients, because there are a lot of things that you have to take into consideration. Whether the implant is stable enough. For example, if the patient is an athlete or have a lot of rigorous exercises or activities in their daily life, and what is the other size, the size of the other opposite breast, whether that would require any kind of augmentation, reduction, and whether it's stable enough, whether looking into the long term, how it's going to behave in the long run, because you want your patients at least to be happy by then. They don't last lifelong, but at the end of 5 years, you do want your patients at least still to be happy with the prosthesis that you had put in. So all these considerations have to be taken into mind.
Okay. So, ma'am, likewise, that we are, as a company, Prayasta is making a personalized breast implant and breast prosthesis, which is going to be leak-proof, one-to-one solution to a woman. And we're also trying to give a natural touch and feel to that prosthesis or an implant. So do you think, ma'am, from a doctor's point of view, I want to know whether such a solution, if available to the women, would be something that would be widely accepted or is needed? Because so far you are aware, ma'am, that there is no personalized breast reconstruction solutions available, at least in India. So, ma'am, do you think that it will help them to at least go back to the way they used to be before the onset of cancer with more
So
confidence?
definitely, see, Shilpi, yeah, when we're talking about this era, it's all about personalized medicine. So personalized surgeries, personalized therapy, personalized targeted therapies. Why not personalized reconstruction, right? So if you're able to provide something, you guys are doing a great job, having something which we can suture so it doesn't move, and having something which doesn't have the patient doesn't have the fear of rupture if they fall on that, on the prostheses
Oh,
or
yes.
head on, or and if you're talking about, you're saying that you claim your prosthesis is going to be long term, it has a long life.
Yes.
And then it is personalized, so you're trying to match the other breast. What it does is that it basically reduces the intervention in the second, on the opposite side, which is something which is which is of a lot of concern to many women. They don't want their normal breast to be touched, whether it is for augmentation or lifts or reductions. So when you're giving them something which matches exactly the other side, you're basically reducing one intervention, which is any day welcome. So it is something which is need of the hour, but acceptability obviously would depend on a lot many other things, the cultural background, the patients, the social taboos, the patient, which is same with all other implants. But for your implant, if it is personalized, it is any day a very good option for our patients.
Thank you, ma'am. That's wonderful to know and very encouraging, ma'am. So, ma'am, on the parting note, ma'am, I understand you're a very busy person, and just your last thought as a doctor, what would you like to tell the young women who may or may not have cancer? How to be more vigilant and how to go about screening and all the importance of, since you are also associated in spreading a lot of awareness campaign. So with our medium, we are also trying to do something of spreading awareness through people like you.
Great job.
Thank you, ma'am. Thank you. So, ma'am, your last parting words probably for everybody, especially young women.
One thing we need to understand, Shilpi, is that the cancers are hitting our population in our subcontinent 10 years or a decade earlier than in the West. So we had to be far more, our screening programs actually had to be more robust. We have to start screening of many other cancers. We should be doing that. And we have to start screening at 10 years or a decade earlier than what the Western population is recommended for Western population. So we have already discussed the high risk factors, as I told you. And now if you talk about staying vigilant and alert, I would request women out there, especially who are the ones who are, very in that high risk group between 40 to 70, to stay vigilant about any subtle changes. Although 70% of the lumps that would be in the breast would be benign, but unless you seek advice, you will not be able to understand whether you belong to that 25-30% category who requires intervention, or this category, right? So the first and foremost thing is understanding your normal tissue, understanding your normal structure, going for a regular and learning and going for a regular breast self-examination. So it makes you aware of the normal feel of your organ, right? You can do it monthly yourself because you don't have to go anywhere. You just have to learn it and do it. And we are there to teach you whenever, whosoever wants to learn it. And there is a lot of information available on YouTube, also those informational videos. So the second thing is whenever you feel there is a lump, and won't wait for pain. Pain is the last thing that can happen in cancers. Pain is a normal phenomenon in the breast. We call that mastectomy, that is hormone related. So we're not talking about the pain. If you have painless lumps, they are even more dangerous. So sometimes patients just ignore because there's no pain. So whether it is a lump which is painful or painless, you still need to go and get yourself examined and screened, and get a sono mammo if you're less than 40 years of age, get an X-ray mammo if you're more than 40 years of age, because unless we see that organ, we have the physical examination, we will not be able to understand whether this pain is generating from that lump, from the rest of the breast, or whether this pain has brought our attention to something else which was sinister and which was lying inside, lurking inside. And any kind of nipple discharge, especially if it is coming from one side, patients have to be very careful and get it evaluated. Then any kind of skin changes, although they're very late, skin changes like thickening of the skin, thickening of the nipple complex, or any kind of lumps in the armpits. They're all late changes, but at least they have to immediately seek advice for that. So the most important thing is staying aware that breast cancers are the number one killers in women, and they have taken over the cervical cancer, which used to be number one killer in women. So this is as important as that. So we have to stay alert. We have to go for our screenings, regular screenings, less than 40 sonomammos, more than 40 or we have to go for X-ray mammos. And then depending upon what kind of lesion we have found, we'll tell you how frequently you require an X-ray mammo, or whether you require any follow-ups with the sonographer for that lesion.
Yeah, that's a good thought, ma'am, and quite a lot of insight I'm sure that the viewers will have when listening to your your interview right now with us. I wish you all the very best, ma'am, and thank you so much for your time, and thank you so much once again, ma'am.
Pleasure was all mine, and it's an honor, and it's very humbling that if I've been able to even put the message across to whoever was listening to us. And I really hope and wish that women out there understand. And one very important factor that I want to stress upon is stress. So stress is one of the major causative factors for many cancers also, lack of sleep. So please get some rest for yourselves. Don't burn yourselves out. Do some meditation, de-stress yourself, and stay happy and healthy.
Thank you, ma'am. I really hope that all of us can imbibe what you just said. And I really wish that I could do that, because I certainly lack sleep now. And there's a lot of stress. Yes, ma'am.
8 hours of the sleep and deep sleep.
Yes, ma'am, absolutely. Thank you so much once again, ma'am, for your time, and wishing you all the best with the inauguration tomorrow, ma'am.
Thank you very much, and wishing all the best to Prayas for all their new endeavors and for all that they're doing for the community. All the very best.
Thank you, ma'am. Thank you.